Good morning. Welcome back to Catch Up with Chuck, a periodic live broadcast from the Rural Futures Institute at the University of Nebraska. I'm Chuck Schroeder. I'm Executive Director of the Rural Futures Institute, and today we're going to be talking about rural health care. One thing we know is that access to quality health care is a critical issue in determining a rural community's capacity to thrive. So, it's a key concern for the Rural Futures Institute, and we're going to be talking about that. Now, if you have questions or comments as we go, I'm going to ask you to post them. We'll try to respond during the broadcast. If we can't, we'll get back to you one way or the other. Well, listen, I'm so pleased. Joining me today is a friend and colleague, Marty Fattig, who is really on the front line of this very important issue for rural Nebraska and rural America. He's both a CEO of a successful rural hospital in Auburn, Nebraska, but Marty is also a very important voice at both the state and national level on both policy and the practice of delivering effective rural health care. And I want to quickly add that Marty is, we're proud to say, part of the inaugural class of RFI Fellows. So, Marty, thanks for joining us. And talk just a little bit about your really interesting background.
Well, thanks, Chuck, and it's been a real pleasure to be involved with the Rural Futures Institute and to be a fellow, for that matter. I grew up in a small town in Wallace, Nebraska, out in southwest of North Platte. I tell my city friends that I graduated third in my class and didn't make the top 10%, to give you an idea about the size of school I graduated from. After that, I went to North Platte Junior College, frankly, because I was poor and I could afford to go to junior college. Went to Kearney, got a degree in medical technology, which is clinical laboratory science, worked in a laboratory for a number of years. Went to work in Grant, Nebraska, worked in Grant for 16 years, then went to Scottsbluff for 7 years, to McCook for 4, and now I've been in Auburn for 15 years, and all of it in rural healthcare because I like rural.
Well, Marty, you have demonstrated that a small town kid can have an impact not only at the community level but state and national. Well, listen, you're involved in a number of initiatives relative to rural health care, but recently you and I have been working together on a task force that you assembled, a very broad-based task force addressing the question, how do we effectively deliver health care in rural communities in an era where there may be fewer hospitals? And by the way, how do we do that without simply turning to government for more and more investment? So could you talk a little bit about that task force?
Certainly. That task force has been a lot of fun and been very, I think, enlightening about some of the ideas that have come out of it. It all started when a friend of mine came to me. She is actually the president of the Nebraska Rural Health Association, and said, Marty, how are we going to maintain health care in these rural communities if they can no longer support a hospital? And I said, I don't know, but we probably ought to find out. And Leslie Marsh out in Lexington asked me that question, and since that time we have put together a group of colleagues from various backgrounds across the state, a lot of the association type people that deal in healthcare, the medical association, the hospital association, the long-term care association. We've involved academia and the Rural Futures Institute and the Nebraska Rural Health Association, along with some other colleagues that I know are just great policy and good thinkers. So,
and some CEOs like yourself that are progressive and doing
exactly.
cool things.
Yeah, exactly. Yeah, we have that. Have to have some of those people in there too, I guess. But
well,
yeah,
I have been so impressed with the diversity of the group you put together, Marty, and it's led to some really high quality conversations that get down to how do we really answer this question. Well, one of the potentials that was identified really came out in our last meeting last week is the potential for the creation of regional collaborations. Cooperatives,
Exactly.
if you will, which is a big deal here in Nebraska, that can strategically share resources in order to achieve cost-effective as well as people-effective solutions. There's some real-world examples going on, and I thought you might want to talk about those.
Well, there are a lot of these examples are just in their infancy, but we are getting started. We decided, I think it was very useful for this group that we're meeting with, being rural people, they said, why can't we do what agriculture has done and develop these cooperatives, which have been quite successful in rural areas, especially in Nebraska? So that is actually being done out in the central part of the state. Holdridge and Lexington and Minden and Alma and Cambridge have formed a cooperative out there. They're doing some things together. They've been together a little over a year, and they're starting to do some work together. Jim Ulrich in New York Hospital is talking about getting together with some of his colleagues and seeing what they can do collaboratively.
Who's had some success previously.
Previous
McCook,
success when he was at McCook, working with the Oberlin Hospital, even
right.
across state lines this works. And I'm have the intention, and I've been sending out emails and talking with CEOs in southeastern Nebraska to see if we can get together and talk about some things we can do collaboratively.
Marty, what I thought was especially interesting in those conversations is we got down to, okay, what are the key elements? And two things came out. Number one, the effective use of technology. We talk a lot these days about telehealth and its potentials, ranging from record sharing to virtual reality, from diagnostics to ways in which patients can stay in their home longer, self-monitoring. So the technology is important. But what also came out is, you know what? It's all about leadership. It still comes down, if we're going to create regional collaborations, it comes down to leaders who are able to build relationships, who are able to build trust relationships across borders that we know historically are not easy to cross. But those seem to be the key elements. Am I on track?
You're exactly on track, Chuck. We've talked. The RFI talks a lot about this being a high-tech, high-touch time in our life and in the development of rural areas. We see the same thing in healthcare. That we talk in healthcare. I was just at a meeting on the East Coast the other day, and they talked about the successful successes in a hospital many times are 100% based on or 80% based on process, 20% based on technology, and 100% based on culture. So I don't think we can forget that culture piece either, because it is so important in whatever we do.
I've heard you say that, and by the way, and I've been to Nemaha County Hospital and seen it demonstrated just hanging around there with you. And the kind of collaborative relationship that you've established not only with your staff, from docs to janitorial services, but the relationship you have with your patients.
Absolutely.
They see that, and it influences the way they feel about their health care. So, well, listen, those of you that have seen the Rural Futures Institute strategic plan that we developed early this year, you know that our big, hairy, audacious goal is a thriving, high-touch, high-tech future for Nebraska and the Great Plains by 2040. We are so pleased to be working with leaders like Marty Fattig, and a key element of that in the healthcare realm, and by the way, it goes beyond, but who are demonstrating on a daily basis the high-tech, high-touch approach, how it can be done effectively, and by the way, create a genuine, brighter future for rural. So we're going to be collaborating in the coming months. We had a little meeting before this broadcast this morning talking about how the Rural Futures Institute, working with Marty and others in the healthcare, community leadership, cooperative realm, can in the coming months do the three things that we think we do well at RFI. Number one, convening diverse talents around a critical issue. Number two, contributing to the future by highlighting some important potential solutions. And number three, celebrating rural successes, really elevating the voice of rural for those folks that are out there making a difference. So, Marty, you're a leader who is helping to genuinely build hope for rural communities. We're proud to be associated with you. Thanks for what you do, for your involvement with the Rural Futures Institute, and let me give you a chance to say whatever else you might like to today.
Well, thanks for this opportunity, Chuck. It's been great to get together with you again, and we always have a good time when we get together. But I think it's really important to note that you have done a lot of work on the key elements of building a successful community, a vibrant, progressive community. And what I have learned in my association with you and with the Rural Futures Institute is those same elements are vitally important to successful healthcare organizations. We need to do exactly the same things that you do, you try to develop in rural communities. And so it's important, I think, that we work together for the success of both our organizations.
Collaboration is the key.
It sure
so
is.
Listen, I just encourage you to stay in touch with the Rural Futures Institute through our newly redesigned website. We're pretty proud of that. And know that we're going to be back with Catch Up with Chuck in weeks ahead. Again, looking at people and places, innovators, leaders who are making rural communities the best choice for worthwhile living. Thanks for being with us.